Hello everyone and welcome back. I am Dr. Mike from Australia. We are diving deep in a topic that might quietly ruining your sleep or your partner's. We are talking about snoring. What causes it, how it affects your health, and what you can actually do to stop it, including laser treatments that could change your nights forever. So let's start with the basics. Snoring is the sound of soft tissue vibrating in the back of your throat while you sleep. When we drift off, our muscles relax, and then that includes the soft tissues in our mouth and throat. For some people, that tissue becomes loose enough to vibrate as air passes through, creating the all too familiar snore. So, while snoring is often joked about, it's not a laughing matter really, especially if it's loud, frequent, or disrupting your life. And the real impact of snoring is not just keeping your partner awake. It interrupts your sleep too. Your body may be waking up dozens of times at night without you even knowing. Just to catch up a proper breath. So people who snore regularly often feel tired, foggy, or even irritable during the day. Does it sound familiar to you? And it's not just you. Over 60% of adults snore, and the number only increases as we age. Why? Because our tissue loses tone and firmness, especially around the throat and soft palate. So it is not just one thing. It's a whole list of reasons people snore. Nasal blockages from cold, allergies, or even polyps. Muscle tone loss in the throat and tongue, often worsened by alcohol or sedatives. Being overweight, which adds pressure to your airways. Anatomical issues like a deviated septum or enlarged tonsils. And yes, men are more likely to snore due to neck anatomy, but women snore too, and they are often underdiagnosed since their snoring tends to be softer. So, no, not every snore is just a snore. If you're stopping and starting your breathing during sleep, you might be dealing with obstructive sleep apnea, which is a more serious condition where your breathing literally pauses. That requires different treatment and possibly a sleep study to diagnose. So let's talk solution here. Lifestyle changes like weight loss, reducing alcohol, and treating allergies can help. But for many people, these alone don't cut it. That's where laser snoring treatments come in. At our clinics in Melbourne, Sydney, Brisbane, and the Gold Coast, we use a Apnoea system called Night which is designed specifically to tighten the soft palate and reduce those vibrations that cause snoring. How does it work? First of all, it's a quick treatment, around 30 minutes, and it requires no downtime. You can go straight back to work afterwards. There's no pain during or after. There's no special preparation that you require, and there's no downtime, as I said before. So it works by gently heating. It's bulk heating of the soft tissue that you can't feel because the machine is calibrated to cool down between pulses so you don't feel any overheating in your throat. And as I said, you don't even need anesthetic for that. And the way it works, it encourages collagen remodeling, which means tighter, firmer tissue and less snoring over time. We suggest to start by assessing your throat properly and the descent and the obstruction by Malampati scale. And we are classified as mild, moderate, or severe. And typically, if it's mild, we need 3 spaced treatments, few weeks apart, which we will discuss when I see you. And while it's not a total cure, many patients see up to 70% reduction in snoring with improvement continuing over time. Now, after your session, you might feel a bit of little dryness or scratchy throat for a couple of hours, but water drinks will soften that. I'm sure you want to ask me, is it safe? Laser is an acronym for light amplification systems. It's not radiation. So it is very safe. Studies show that laser snoring are well tolerated. I've treated thousands of patients over the last 9 years, and it's genuinely improved both snoring and sleep quality. And patients will come back and tell us, I sleep better, my partner sleeps better, and I finally wake up feeling rested. That's the goal of the treatment. So is it the right treatment for you? I would say if you snore regularly, you have tried lifestyle changes with no success, you don't have obstructive sleep apnea, even though it can help in certain mild to moderate cases of sleep apnea as well. So my final thoughts are, if snoring is affecting your quality of life or your relationship, don't ignore it. There are real solutions that don't require surgery or machinery of CPAP. At our clinics, we have helped countless people through our night laser program with the fraternal laser. It is safe, simple, and honestly, it is life-changing. So, if you need any consultation, don't hesitate to contact us and we'll discuss it further. We'll assess the cause, the likely cause of snoring, and we'll assess the level and degree of obstruction in your throat, and we'll treating accordingly. Until then, sleep well and live well. Thank you.